Thank you, Prof, for that introduction. It is an honor for me to stand in this podium to represent so many young scientists and researchers that have been trained in many mentoring programs. Like you said, I've been working mostly on HIV. I've been mentored through a Young Mentors program, and the ideals of what James Hakim stood for. I studied at the University of Zimbabwe. When he joined, I was actually doing my second year. And I met him again during the AIDS clinical trials group through many clinical trials. And he used to bring us together as young scientists and really talk to us about thinking ahead about our careers and what we are looking forward to. So I'm really delighted to be able to give this talk in his memorial. I'm going to, one of the speakers in the previous session actually summarized my talk. He said we should not waste any crisis. So I'm hoping to highlight a few things that I've picked out, how some elements of HIV capacity have been adapted for COVID-19 response. And of course, as a young scientist, also reflect some of my journey of the intersection between HIV and SARS-CoV-2. And also some of the lessons I can avoid to talk about pathogen genomics and the lessons we have heard and how this has changed the way we manage pandemics. We see that HIV and COVID-19 have provided a unique opportunity in time for us to learn, to leverage, and build resilient systems for health. In many times, it demonstrated our lack of preparedness, but in other ways, it also showed us how you can leverage from systems that you have developed over time and the training that you have acquired over time to really massively respond to the pandemic. The screen is okay. This screen is out. So we see that the long decades fight that we've had has offered so many lessons. And there are so many new lessons that we are now learning from emerging pathogens that we should be able to plant back. And the elements, I'm going to look at elements that have been described in terms that are relevant both from the HIV and for COVID-19. The four key ones that I could see in health system strengthening, what have we put up in HIV that has been very strong leveraging point for COVID-19 response? Looking at clinical capacity for managing complex patients from the HIV side, and also community engagement has never been so critical in terms of service delivery, in terms of rolling out interventions. And of course, the pandemic has shown the importance of investing in laboratory capacity. And also we have learned from the rolling out of HIV testing, from HIV viral load, from EID, from point of care, the lessons that we have allowed us to leverage from there to respond to the COVID response. In terms of healthcare system strengthening, one of the key was response coordination, how we've organized our response. You saw the Ugandan response coordination, how they outlined 12 pillars of response. That has been a great learning that helped us also in terms of responding to COVID, that we quickly put in our response teams that allowed us to plan areas around how do we expand, how do we take care of safety, and also what was very important is data-driven approaches to interventions, to deciding what to do next, to informing lockdown and easing of restrictions. So the data-driven approaches has been very important, and we've learned a lot from HIV. Just looking at clinical capacity, we've also looked at and seen that the PrEP has really helped us the management of HIV for opportunistic infections, and also linkage to care and retention. And this is where we see the evidence-based implementation of contact tracing, linking individuals to care, and also implementing infection control guidelines that have been very important, and coming into case recognition and rapid diagnosis of cases. When it comes to lab, that's my passion. I spend most of my time in this space. Of course, I'm also in public health. We've seen that with the diagnosis and the capacity that was developed through HIV, and most of the labs sadly had to close and turn their HIV testing molecular platforms to testing for HIV. Of course, that had a huge impact, but also it shows that the capacity that was developed when building the systems became very essential. Countries that had decentralized systems for viral load quickly introduced molecular testing for COVID, faster than countries that had not decentralized, showing that decentralizing HIV testing was very important. Or countries that had mapped sample referral systems, how to manage specimen referral, maintaining integrity of samples, also quickly leveraged on those responses. In Botswana, there was a mapping of referral mechanisms of all health facilities in the country. And when COVID hit, that was the same system that was used to start testing at central level, and soon after decentralizing to other labs as well. And of course, sequencing and monitoring of variants. We've learned from HIV, monitoring drug resistance related mutations, viral evolution, mapping transmission networks from sequencing has been very pivotal. And I'll show you one of the utilities of the tools that we learned from HIV in terms of monitoring variants. In terms of community engagement, contact tracing and support of individuals in quarantine we've highlighted some of the areas that were mentioned in the previous speakers, how it exposed our vulnerability in terms of people living with HIV, home-based care for severe illness, and these were very important in the response that we have learned from HIV. Of course, being a scholar, from HIV scholar, starting from 19 years ago, I started as a trainee under Max Essex Lab, and that was very important through the Focus training program. And I put up this slide to highlight the importance of mentoring. And as I stand here today, I'm a cumulative sum total of many people that I've gone through. I've just highlighted a few here that have been important in my career, exposing me through some of the grants that we've held. And I've had an opportunity to be one of the investigators in the Sante Delta's Welcome Program that has really trained a number of scientists, which I'm going to show in terms of capacity for HIV. And now we are using the same platform and adapted to get more grants to be able to respond for COVID, from understanding the virology of COVID, the immunology, the responses, and we're using that same platform. And some of the tools that we developed while studying HIV have been very pivotal in responding to COVID-19. And of course, the analysis of the viruses with the phylogenetic networks, which we have partnered in many countries, including here in Uganda, as well. We've worked with many researchers here in Uganda in trying to map the phylogenetic networks of HIV in Africa. And that platform, we have adapted it as well to be able to understand the viral evolution in the context of COVID-19. And that has been very important, and I highlighted some of the mentors that have taken me through. And I'm highlighting these mentors as well that were crucial in my training program for my PhD, and we continue to collaborate, and up to this day we are working together now in other viruses, including SARS-CoV-2. And one moment with the Director Collins inspired me a lot to think in science in terms of global health, not just focusing only on HIV and focusing only on your lab, but to think bigger in terms of public health. And some of the lessons that I learned from colleagues were very instrumental in my response. So I'm highlighting this so that you understand how training has been very impactful, but it really came from the HIV side. And that is the kind of training that we've been able to implement. For example, next generation sequencing from HIV, from a study that we did, a combination prevention study, and I see some colleagues in the audience who studied some of those studies in Botswana, that we generated thousands and thousands of sequences from HIV using next generation sequencing. And that was pivotal for us to jump into that platform to adapt for the COVID response. And also analysis of mutations that we were used to. Now we turned out to COVID and then say, how is this virus changing? So it was not an accident that we are looking at those mutations on a daily basis. We are checking what has changed, and that's how you identify new variants. By looking at the virus, looking at the key indicator signatures, and you are looking and see whether is anything in changing that might impact immune response, that might impact treatment, that might impact transmission. That's very important. We've also studied phylogenetic structure of the Botswana HIV epidemic, mapping transmission networks, and we've turned the same for COVID-19, and I show some of the pictures down there. And this network, the Sante network, is one of the networks that I became part of as part of my training that has we've used now for leveraging for COVID-19. And through this network, we've trained a number of scientists, more than 101 recruited, and 35 PhDs, and 13 postdocs. And I'm one of the 13 that became part of that training mechanism. And that was important with the kind of grants, that system that helped us, mentor us. And now we are looking at the intersection of COVID-19, TB, and HIV. And in all the capacity that we developed from culturing HIV, from understanding the immune responses to TB and HIV, and adapting it for COVID-19. The phylogenetic networks for generalized epidemics in Africa is one of those networks that we are involved in, including Uganda here. We are proud of the Rakai program, where we try to identify sources and sinks of HIV epidemics in Southern Africa. We also map the structure of the epidemics. We analyze clustering of drug resistance. We also analyze, we generate tools to look at directionality of transmission. And this network has been very crucial. And so this is the analysis that is looking at the phylogeography of SARS-CoV-2 that we've just completed in Botswana, using the tools that we developed from HIV and the collaborations that we have established, looking at the movement of the viruses between the countries that I've shown there, just highlighting the dynamics of the movement of the virus, and also the diversity that occurs during the movement of these viruses. So the multifaceted training programs that we saw in HIV have been very crucial. From community engagement, which I really want to emphasize, as a virologist, I've learned the importance of engaging the community, explaining what is a mutation, explaining what do these changes mean, has been very, very crucial in the buy-in for some of the complex studies that you need to do. Understanding the ethics of doing work, the data and informatics have been crucial. COVID exposed some of the challenges of not investing in informatics or not investing in data, and that has been highlighted, is still coming from HIV as a problem and is still a challenge in the COVID era. Health communication has been very crucial, making sure that the message is clear. What does it mean? What does it not mean? And also, we cannot not talk about the financing, the role of major sponsors in HIV, the role of PEPFAR that is played in rolling out HIV treatment and care. And these tools, we need to adapt them. We shouldn't waste what we have learned from HIV. We should adapt them to the COVID response. And of course, I love to talk about the specialized genomics labs all over Africa that have been critical in raising more than 100,000 genomes to date of SARS-CoV-2, an amazing achievement that we should clap hands for this achievement in Africa by African scientists with a lot of collaborators that are interested in developing capacity right in Africa. So we're proud that some of these networks actually started doing their work from HIV, and you can see that they quickly pivoted to respond to COVID-19 pandemic. Some of the challenges we have learned there is how to move biological samples across countries, the legal issues, the issues around material transfer agreements, the issues around data ownership and data sharing, the issues around public repositories. How do we ethically handle data in public repositories? And member states should be able to gather together, and the effort of Africa CDC is right now is to bring member states to look at some of these policy issues and some of the capacity issues, and how do we roll out this highly specialized testing to make sure that all countries have capacity within country to do this particular work. And of course, it has resulted in major publications that you can read out there. And recently, we have released another publication describing the evolving SARS-CoV-2 epidemic and showing some of the insights of the expanding genomic surveillance. Reach out for this paper and these two papers. You will see the lessons that we have learned, some of the tools that we have highlighted that are really required to take us forward. And how now we are turning into other pathogens like TB, making sure that we don't leave other pathogens behind now that COVID is the buzzword. We've used this system in Botswana to track variants, and we have identified in our zones using the same infrastructure, and that was very critical for us to know what's going on a real-time basis. Is because of the system that was existing and the decentralized healthcare system that was existing, and we could quickly tap in. And when we quickly tapped in, we managed to provide a wide coverage for sequencing for the entire country using existing infrastructure and sample referral network that was enhanced through HIV and TB. So some of the contributions from HIV and TB interventions have been very critical in us achieving what Botswana has achieved, probably the highest sequencing coverage per capita of any country has ever achieved. Sorry. And in that, I described the background so that you understand that we're looking at these events on a daily basis. And one event on the 11th of November that changed the world is a group of travelers with an unusual lineage. With an unusual lineage sequenced in the following week. And as you can see, I don't know whether the pointer can work, but as you can see on the red circle there, they appeared unique when compared to other circulating viruses. And when we looked at them very closely, actually some of them were traveling together. And when we looked at them very closely, we realized that they were so unique of anything that we had seen. Little did we know that was the beginning of the entrance of the Omicron variant. An independent group working at the same time also noticed some changes in some PCR technology, what we call as gene target failure, at the same time. And because we are in the same network, we're able to talk and realize that this actually represents something strange, something new that has so many mutations. And then, of course, you know, by then, by the 26th of November, WHO declared it a variant of concern. And it continues to evolve, and we have seen that we have the original Omicron BA.1. Now, most countries are experiencing another version of Omicron BA.2, and recently, again in Southern Africa, not because it's not there elsewhere, because of the surveillance system that is in place in Southern Africa, especially in Botswana and South Africa, we're able to detect BA.4 variant. Because of the weekly sampling in the systems that have been set out in the health system, and we are seeing that it's now increasingly becoming the variant that is becoming the largest in terms of proportion. We are watching this because, as you know, South Africa has entered the 5th wave, and we need to be monitoring and see what could this do. The advantage is that we see that we don't see corresponding high number of deaths, and of course, slight increase in hospitalization, but we hope vaccination is really going to be very, very useful. And at the bottom there, this is the trajectory of what we have seen in Botswana. So this is the picture, and one of the things I learned in communication is how do we make sure that the evidence and the data we generate becomes useful and does not destroy economies, does not destroy the gains that we have built, and you know that the travel bans, to some of our scientists, we were almost watching every step we take and everywhere we go, because it was like, what have you done? What have you done? And when we look back, we see that we did the ethical thing to share the data. But it's important that data should be transparent. We believe in transparency of data. And some countries, because of the backlashes of variants, they delay depositing data online. And we believe, and with the support of our president, came out very strong, visited our facility and our labs, and said, guys, continue what you are doing. And that's the kind of leadership support that is necessary in responding to the pandemic. Just to highlight some of the impact that has had, and my last thoughts in the last few minutes I have is the pathways to successful capacity building for both HIV and COVID is we need to strengthen our systems in Africa to identify a critical mass of trainees and mentors. We need mentors. We need to mentor young scientists, identify projects that are African-led, that African-based researchers in strong collaborations, and make sure that we mentor our scientists to take their data out, to get the requisite grants that are necessary, to develop the research infrastructure, and also be involved in community engagement and public engagement. I can never emphasize that. I learned it recently. That is very, very important through COVID. And it will really give us a sustained funding is very crucial. Scientific collaborations, COVID has taught us that no man is an island. You cannot work alone. You need others to work together. And we need our African governments to invest back into the research. So in conclusion, my thoughts on adapting HIV, what we've learned from HIV to COVID response is that COVID-19 has led to accelerated research efforts globally and has highlighted the importance of community engagement and leadership in the COVID response. And also the technologies that we used for HIV, from the PCR technologies, viral load, early infant diagnosis, the point of care that were developed to increase HIV testing and shift to a model of self-testing and community-led programs have allowed the rapid uptake of SARS-CoV-2 testing in low and middle income countries. And we see that these strategies also for isolating and manufacturing broadly neutralizing antibodies for HIV have been applied to SARS-CoV-2, and many of them are in clinical trials, and that's how we have been able to get novel platforms for vaccines. And we can see that the novel vaccine platforms, the nucleic acid-based vaccines such as DNA, RNA, and live vectors, again developed under HIV, have been very crucial in the development of vaccine response. No wonder it was an accelerated development of vaccines. So overlapping epidemics represents an opportunity to extend cross-disciplinary research into integrated service delivery for other pathogens. We shouldn't forget other pathogens. These are the men and women that really make this work worth going to work every day. A team that I work with that I'm proud of, that has contributed many ways in HIV, in TB, in hepatitis, in herpes, and also now in SARS-CoV-2. And of course, this is the team that is behind my work, and trying to get that balance is always important, and they are always trying to push me to the center. Most of the time, they are on the other side of the scale. I'd like to acknowledge some of the funders of this work. I've been through training NIH programs, the Fogady program, where I started all my work, and some of the funding for the work that I'm doing that I've received, the support from the Ministry of Health, the government of Botswana, my mentors, some of the collaborators in Southern Africa, the NGS-SA sequencing platform from CRISP, and Pangea Network, which I belong to, and of course some of the support from the African Union and the Africa CDC in developing this capacity. Thank you so much for allowing me to share my thoughts. Thank you.